this is Dr. Salma Aziz, and this morning we'll talk about our children and the health of their feet. As most of us parents realize, we pay attention to all aspects of our children and want to make sure that they have the best of everything so they can have a healthy life. One of the areas that most of us parents are not very mindful of is that our children's feet, because most of the time our children don't complain about any foot problems and they just go through school and life and are not saying much. But it is our duty as parents to make sure that we have a professional assess and evaluate our children's feet, especially when we have that child that constantly complains of, you know, Mom, Dad, my foot hurts. I don't want to do this because my ankle hurts. I know we've all heard it. So sometimes it's worth it to, when they complain that much, and if it's consistent, it's worth it to have them looked at and perhaps see if there's any validity to what that child is complaining about, or is it simply that they don't want to do the task. So to do a brief recap, children's feet are not little mini adults. Their feet are very different, and we have to understand that, and we have to treat their feet as a child, not as a mini adult. Most of the children that are seen in our office are commonly seen for either being born with flat feet or very problematic arches as far as their foot are concerned. And one of the most common things that we see in children in our office is heel pain. Believe it or not, heel pain in my office affects more children than it does adults. So just to give you a brief recap, here's what happens. Most of our children that are active in their sports, all of a sudden don't want to do the sport. They're complaining of foot pain. They're limping off of the baseball field or the soccer field, and complaining of heel pain. Most parents, you have their kids rest only to find that as soon as they become active again, this pain returns. This is the growth plate of most children that becomes symptomatic because of the fact that the structure of their foot is unstable, there's too much pressure on the growth plate, and this is what the child is complaining of. So just to give you a quick little anatomy review here, this is a model of the foot and ankle. This is the back of the heel where the leg and the Achilles tendon comes and attaches. And most children that have this growth plate pain, commonly known as calcaneal apophysitis, present with pain right back here in the back of the heel. They're not able to place that heel onto the floor. And again, the root of this is the instability of the foot that the child was born with. Yes, parents, you're the reason, it's genetically your fault, but the pain is felt back here in the heel due to the instability of the foot and ankle. Again, the treatment for this instability, as we've covered in other videos before, become orthotics. And so we have very specific orthotics for children's feet. These are, if you recall, the orthotics for adults, they're very different than this because, again, it has to take into consideration a different type of control and support for that child's foot. So here I have some that are for that severe flattening child's foot that actually has a medial buildup on this side right here, on the side of the arch, that prevents their arch from truly collapsing onto the ground. And then, as I said, there's different types of orthotics that we make for children based on their deformity and the shape of the foot that they have. Just again to show you another foot deformity that's often presented to our office is parents come in and complain about the fact that my child is either a toe walker, they don't want to put their foot down on the floor, or they complain about their child's foot being such that the toes are going inwards, in-toeing. These all are deformities that are typically genetically acquired on that child's foot. And if a parent is able to have the patient be evaluated properly at an early age, we can easily treat them with conservative measures such as orthotics to give them that healthy foot that can carry them out throughout life and not have your child become the couch potato that doesn't want to maintain activity. So it's beneficial to get at least a baseline evaluation of the child's foot, and if needed, the proper custom foot orthotics for them, so your child is happy and active. Thank you for watching today, and hopefully today's educational message was of use to you guys. Have a great day.